Good afternoon, my name is David, and I just want to introduce some of you to the idea of proper breathing. Because I've been witnessing when I've been doing client calls or working with clients and also talking to people, this idea of improper breathing. So let me just demonstrate for you what an improper breath is. An improper breath is the breath that is shallow, that lifts up your shoulders. So most people breathe like this. Let me see if I can back this camera up. If your shoulders are going up, you'll feel your neck kind of bulge. And that's an improper way to breathe. And most of our society is breathing that way. So what is the proper way to breathe? The proper way to breathe is to put your hand on your belly. And when you breathe in, you'll feel your diaphragm expand. And when you breathe out, your diaphragm comes back in the body. Now, what you may notice is that if you've been breathing improperly, when you breathe in, your belly, your diaphragm may go in. So it's an easy correction. So when you breathe in, allow that tummy, that diaphragm to go out without moving your ribs or your shoulders. And then you breathe out by gently allowing the stomach to go back in that diaphragm area to push the air gently out. Good. So we're going to breathe in through our nose. Noticing the diaphragm pulling out. And then when you exhale out, diaphragm pulling in. And so what happens is the diaphragm all the way around your back and the sides will fill up. And then they'll exhale. So the breathing is actually done in the diaphragm area. It's not done up here in the rib cage area. The shoulders aren't moving. And what you'll notice is that as you start to properly breathe, what will begin to happen is you'll find your feet grounded in the earth. You'll find that your mind will quiet down, will relax. You'll find that you'll have more control over what's coming up inside of you. And you'll also have lower blood pressure. Your heart won't be racing. This also helps with people that have attention deficit disorder, that they tend to breathe up here with their shoulders moving, and then it puts stress on the mind, and the mind just starts going, oh, what am I going to do? What am I going to do? So proper breathing is to allow that breath to go through the nose, hitting the back of the throat, coming down to the diaphragm, expanding the diaphragm out, and then gently the diaphragm will be pushed down. Air will come back up through the throat, through the nose, and come back out. So that is proper breathing. It's helpful. It will change your life if you can incorporate proper breathing back into your life. It will change the way you think about things. It will keep you here. It will help you manage your emotions so your emotions don't overwhelm your mind, and then you start acting from emotions and reacting. So we'll just do a couple more times just so that we're on the same page. This is improper breathing. Kind of shallow breathing. I'm over exaggerating it, of course. And then proper breathing is letting the air come in through the nose, hitting the back of your throat, coming back down, filling up the diaphragm, and then allowing the air to go back out as the diaphragm pushes back in, air goes back up and out your nose. So again, my name is David. If you want to follow me on Instagram, you could follow me at White Lion Energy. If you want to follow me at Twitter, again, it's at White Lion Energy. And on Facebook, I do have a Facebook page called White Lion. So thank you for your time. Thank you for listening. And continue to properly breathe. It will change your life. Thank you.